clear picture of where we are at and what will happen next. Before we get into that, 633 cases in New South Wales today, 462 COVID patients in hospital, 77 people in intensive care. It is distressing. I know all Territorians are thinking of our friends in the east, and I know all Territorians never want us to be in that situation, because that is a situation that we wouldn't come back from here in the Territory. Right now, from New South Wales, we are getting a daily tragic reminder of why we can take no chances here. This is why we lock down fast and hard, because whether it's 6 or 60 or 633 cases, it starts with 1. Our outbreak started with 1, and we want it to stay at 1. To the Territory situation. Yesterday, things were looking good, and we still had some unanswered questions. Since then, every answer that's come through has been a good one. It's all been good news so far. There were no new cases of COVID-19 in the Northern Territory overnight. 2,128 tests were undertaken yesterday, all negative. We have reclassified some of the exposure site contacts, including the Uber customers, who are now considered casual contacts. The number of close contacts now stands at 93. 12 have left the Territory, so we have 81 close contacts in the NT. All close contacts in the Territory have been contacted and isolated, and all except 1 have been tested. The person who hasn't been tested is actually now on a ship off the coast of the Territory in international waters, but we're still classifying him or her as a Territory close contact. The ship has enacted their COVID safe plan, and the man is feeling well. Of the 80 tests that have been taken, 65 have come back as negative, and 15 results are pending. We expect to get the remaining 15 results back today, and we'll let you know as soon as we get them in. We have now identified 504 casual contacts from the exposure sites. 411 of these are from the Katherine exposure sites. All of these people are required to isolate, get tested, and stay isolated until a negative result. So far, 280 of the Katherine casual contacts have been tested. A handful have already received their negative result. They will take a few days to get through everyone. But that's okay, because the important thing is that they are isolated while this happens. We've managed to confirm that of the 504 casual contacts, all but 12 have been contacted and their isolation confirmed. They will stay in isolation until a negative test result comes back. We have about 98% of our casual contacts in confirmed isolation. We will keep tracking down the remaining 2%. To be clear, this does not mean that they are not isolating. It just means we're still trying to contact them to be absolutely sure that they are. So at this point, we are feeling good. We are confident we've caught this thing in time. We are confident that we have trapped the risk, and we are confident that our tracing efforts have been a success. So what's next? As I said earlier, we want to get all the results back from the close contacts today. We want to get more assurance that all of the casual contacts are isolated, and we also want to get the wastewater results in. We're expecting to get those for Darwin late tonight, quite late tonight, and Katherine tomorrow morning. Just on that. Once we do get the wastewater result, don't be alarmed if the results are positive. We actually expect that it will be. We are more interested in the trend of the infection. We already know the man was infectious. The most important thing is the results, testing results from the contacts, close and casual, and everything is pointing in the right direction. All of this means, at this stage, we are fairly confident that we can lift the lockdown tomorrow at noon and transition it to being open again, but with restrictions. Confident, but not completely certain at this stage. I can't give you a guarantee right now that the lockdown will end. I'm hoping to do that in the morning, but in preparation for that probability, we'll be working the rest of today on what the restrictions will look like once the lockdown lifts. But at a minimum, it will likely involve wearing masks for another week to get us through to a full replication cycle, just like last time. As for what else we need to do to deal with high-risk settings and with mass events like the Darwin Festival, we are going to keep working on those things today, and we'll have all of those answers in the morning. So, no promises. Right now, it's looking pretty sweet. Just 2 more quick things before I pass on to Dr. Heggie. On vaccines. In the 48 hours since lockdown, there have been 5,000 additional vaccine bookings for Greater Darwin. We are now fully booked through to early September. That's a terrific job. And we have 2 vaccine centres running in Katherine now, one in town and one at the hospital. There's 1,000 accelerated doses for Katherine, and there are still appointments available today, so hop online and book in. We are now in the Territory past 57% of first doses done. Finally, today, we will declare New Zealand a hotspot for the purposes of travel to the Northern Territory, and Dr Heggie can talk through that too. Thank you.
Thanks, Chief Minister. We've got a lot of information here today to analyse in the next 24 hours to determine what comes next. So if I was to say, first of all, yesterday's word I used was appreciation, and today's word's going to be please. Just a few moments ago, I got a text message to say that this index case, his serology is negative. That is, he is very early in his disease, his infection. So it's less likely, but not impossible, that he could have got it in hotel quarantine, but there's no evidence that he would have caught it, of course, in the Territory. If I could say that there's a lot of numbers to consider here, but first of all, thank you to all of the teams that have been working again through the night and to get information for this decision making. If I could say please to get tested if you have any symptoms. Now I'll just reiterate that sometimes the symptoms are unclear. Maybe no symptoms, but are unclear. So even diarrhoea can be a symptom. Certainly a headache can be, or a change in taste and smell. I'm just reminding people of that. If unclear, make a call anyway. If I could also ask, please, to comply with the lockdown. The most important reason for having the lockdown is, yes, it's to stop the spread, but it's allow contact tracers to do what they have to do. And also there's the further testing that needs to be done in a number of ways. It's not the time to have people over to your home or where you live. That is not the time. We know that many of the outbreaks around the country leading to harm and death have been when people have actually had sometimes illegal gatherings. And we've seen that just recently in New South Wales. Can I say also, because this is also protection for you and others, if you either have the infection or you actually might get the infection, wear your mask and wear it properly. Yesterday I saw some Aboriginal people in the street that didn't have a mask. A cleaner in one of the buildings last evening gave them masks. So maybe if you see people who don't have a mask, you might have a spare mask with you. I'd ask also that you please be patient in the next 24 hours. A lot of people are expecting things to go back to normal before the lockdown. That will not be the case. Our lockdown light last time, there are a range of things that were allowed and there are a range of things that were not permitted. And that's because we have not got all of the testing done of all of the close contacts, but the numbers are looking good. That's really important. If you are in lockdown, consider other people around you, people you know who actually are living alone. They maybe do not have a family with them or a pet. Reach out to them by phone, by text message, video. Look after one another, be kind to one another. I will say though, please, again, book your vaccines. We're going to have plentiful supplies of vaccine. Our aim is to get the Territory ahead of all of the other jurisdictions, vaccinated by around the end of October. But that requires your cooperation. I would speak to, please, Aboriginal people that might see or hear this, that in New South Wales at the moment, in Western New South Wales, out of all of the cases there, 60% are Aboriginal persons, and also a large number of them are younger persons. So it's not just the elderly who get this infection. Don't forget, it's highly infectious and highly virulent. So we have to be vigilant ourselves about what we're doing at the moment and what goes beyond any ending of controls we have in place at the moment. So take care of yourself, reach out to one another, but most importantly, we've got to get the vaccine into arms. Thank you.
We've managed to get ourselves in a pretty good position in our 2 lockdown areas. However, as encouraging as it is, we must maintain our level of vigilance, and that's continued. As a general rule, the compliance across the board has been very good. Unfortunately, we've had some exceptions to that. We issued 5 infringement notices to 5 patrons of a accommodation facility along Mitchell Street yesterday who were sitting around the pool enjoying some beverages. Doesn't meet the definition of exercise as much as some may wish it to be. So they're now $5,056 each, poorer for the occasion. We did engage with them. We tried to encourage them. They ignored our education, and hence they ended up with that result. Equally, unfortunately, within the CNR, the people who are very, very privileged to be able to stay at that facility to ensure their protection and also the protection of the territory in our country, we issued 3 infringement notices to individuals there. They are now reflecting on the fact that we are very clear about the point: you cannot leave your balcony and you certainly cannot move around without wearing a mask. So those activities are something that we leap on and we take significant action upon. There was certainly no broader health risk in relation to those activities, but we hold that as a very high benchmark and set that standard to ensure the safety of that facility and everybody who works there, as well as everyone who resides there. It goes to the point that all of our work isn't only within the lockdown areas at the moment. There are multiple activities occurring that continue to be on. I have to point to our firefighters and bushfires NT. We've had a number of fire ban days recently, and anyone in the Greater Darwin area has probably seen the horizon to see a number of bushfires have been burning. So they've been out and about doing those jobs, protecting people's properties. We continue to do that work. The front line across the country, particularly in New South Wales and Victoria, are at the forefront of all of this, and we need to make sure that they're being appropriately supported. That remains the case within our lockdown areas. Please continue to do the right thing. You've really stepped up incredibly well. We're literally, hopefully, only less than a day away from being able to lift again, but please understand it will be with some restrictions. Again, those restrictions to ensure that we're not thrown back into a lockdown. We want to try and ensure that we mitigate this risk as reasonably as we possibly can. To the business owners that can potentially start planning and considering returning tomorrow, please consider how you may take steps to oblige every single person that comes into your premises to use the QR code. I cannot stress enough the importance of having that information to hand, as opposed to the many manual hours that we need to undertake to review footage and other types of information to be able to identify people who have simply failed to use those QR codes. In the absence of your QR code, please make sure that you've got a paper that seeks sufficient information from a person, their name, their address, their mobile phone number, their contact details, so we can move swiftly to advise them to self-isolate until we can get testing regimes undertaken. As a collective, there's been a lot of good things to see through this second lockdown, and we're pushing towards a good outcome. We need to certainly understand the outstanding results that are coming, but the number of contacts that we've managed to be able to reach ensure that they're where they're meant to be, and particularly for those close contacts where we've had to move them from outside the lockdown areas into our Centre for National Resilience, has been a pretty seamless occurrence. So that's something to be very, very mindful of. So from us at the moment, it's a deep thank you, but please maintain the focus for the time being so that we can push towards midday tomorrow. Thank you.
Commissioner, are you aware of non-essential businesses, for example, cigarette shops, buying groceries and then reselling them in order to stay open?
Yeah. Unfortunately, we have heard of the practice of some businesses that ordinarily certainly wouldn't be considered to be a takeaway or a food outlet, moving to that posture, moving to sell items like bread and milk, and even to some extent the magic 2-minute noodles. That has prompted a visit from our people, and again I have to pass on my thanks to many members of the public who have been very vigilant in trying to ensure that we're able to respond when we become aware of those activities.
Are you generally still warning people first and then only fining people if they don't comply following the warning, or are you handing out fines straight away if people aren't complying?
As a general rule, we will always give a person an immediate opportunity to comply. So in the past, where we were a little bit more lengthy with our education there, we still will afford people a reasonable opportunity, for example, to put a mask back on or to cease doing the thing that they're doing that would be in contravention. But we're losing patience in that regard, and once we give people fair warning and a reasonable time, if they continue to be non-compliant, or more to the point, they act obligingly while we're there, and upon us leaving, then return to the practice they are undertaking, there will be no second chance, and that's what's playing out today.
Thank you, Minister. 633 new cases in New South Wales. First of all, do we know what the strain of the virus that the index case here has?
I'll let Dr. Heggie answer that.
Just very quickly, just a text message a moment ago. The shadow of the nasopharyngeal swab, throat swab, shows a shadow of the Delta variant. The genomics result has to be released from New South Wales because they have the original Delta genome. Thanks.
I guess this issue is becoming nationwide and international now that New Zealand has received cases from New South Wales. What are you going to be talking to Gladys about in National Cabinet this week?
We flagged the sitting concern a little while back that we're worried about New South Wales essentially being this incubator and others having to deal with the potential spread of the virus. We're still absolutely confirming, obviously, where and how he caught this, but obviously he travelled here from Sydney via Canberra, so we pretty much know what we're dealing with. We're not the only ones who've had this problem. New South Wales, in some respects, is effectively welded into their state at the moment. We're saying people don't leave New South Wales. I think pretty much every jurisdiction in the country, apart from ACT, has strong borders to New South Wales. New Zealand's now got strong borders to New South Wales. I feel for the people of New South Wales. I mean, we were here last year with Victoria in some respects, but Delta's obviously a game changer compared to what the second wave in Victoria was. So it is alarming. It does show the necessity for rapid action like we've done here. New Zealand's done basically the same thing for their entire country, shut it down off one case. You just can't stuff around with Delta. So we are worried. The consultation National Cabinet will be similar as it has been in recent times about understanding the modelling, understanding what we need to do through the plan, but and confirmation that everyone in the Commonwealth is sticking to the suppression plan and working to get that outcome. We need to see the community transmission of cases in New South Wales go back towards zero. What probably most alarms me about New South Wales is not the overall case number, but the amount of people and time that they are infectious in the community. That's what we really need to get down. That's the figure. And I'm not the New South Wales Premier, so I want to be really careful how I qualify these comments. I'm not in a position to say to Premier Berejiklian rings of steel or curfews or those other things. She knows better than I do the state of New South Wales and Sydney. So I can't give that policy advice. I know what I do in the Territory. I can't speak for the Premier of New South Wales. All I can say is off the data that we're seeing is there's too much movement. And there needs to be some more work in and around movement and how we handle movement in New South Wales. And obviously what I do is as Chief Minister, is making sure that movement isn't into the NT. And so that is an active concern of ours, and it'll be discussed again at National Cabinet.
Several states and territories have reportedly agreed to quarantine people evacuated from Afghanistan. Is the Northern Territory one of them?
We stand ready if necessary. We obviously have the Centre for National Resilience at Howard Springs. At this stage, there are no active plans for Howard Springs to be a place for refuge. But that would just be a practical conversation between us and the Australian government. There have been some operational conversations about what would it take, which I can ask the Territory Controller to talk to. At this stage, though, we're not an active place, but obviously the Centre for National Resilience is really good at what it does, and we'd be available. We've got that agreement with the Australian government. It would require some deferring of flights, etc. We have to factor into the 2,000, but we get it, and we obviously would work with the Australian government about dealing with that.
Just on the timeline, you don't think he caught it in hotel quarantine?
It's less likely.
Right. So
less likely if that's
in
serology.
In Sydney before he then flew to Canberra and on to Darwin, was there a period in between him leaving quarantine when he was then in the community in Sydney? Not
based on our contact tracing, and obviously that would be work done even further again by New South Wales and ACT. We've obviously communicated with those jurisdictions. At this stage, our understanding through contact tracing is left the hotel quarantine, done 14 days, return a negative test, and then travelled by approved means to the territory. So, airports aren't considered hotspots for purposes of travel. We're obviously talking to, I might pass the Territory Controller, we've been talking to those jurisdictions about reviewing CCTV footage, getting understanding of his movements, not suggesting that he deviated from that, but we really want to know where he caught this. And this is a question that's important not just to answer for us in the Territory, but I think as a nation it's important to understand where and how he caught this, because it could impact national policy. We just need to know what happened here. The serology just gives a likelihood as opposed to a definite at the moment. I might just pass the Commissioner just to talk about some of that jurisdictional cooperation.
Everything we know to date at the moment tells us the index case has been fully cooperative, and to the best of his memory recall, we've been able to follow that through. What we've now requested is reviewing of CCTV availability in a number of the other jurisdictions, so particularly the airport around Sydney and also the ACT, just so we can have an understanding of what potential contacts may have occurred there. Equally, our contact tracing teams have been engaged with the relevant health authorities within those jurisdictions just to see if there's any further information we can derive from there. The outstanding relevant results as it relates to the individual himself, and as the Cho has just spoken about the potential period of time as infectivity, will all assist in being able to narrow down those timeframes. So, as you can appreciate, the movement of a single individual through an airport will take many hours of significant CCTV reviewing. So we really want to try and refine that timeframe. But everyone that we've spoken to date, Interstate, is very keen to assist us and lend a helping hand.
Are you trying, sorry, Commissioner, are you trying to ascertain whether he was in contact with someone at either Sydney or Canberra airports, and that's how he may have contracted the virus?
That's an avenue that we've got to try and rule out. So that's why we are working based on the clinical advice we're receiving. If there's some limited possibility that it occurred at the quarantine facility and upon his exit, then we want to try and understand, did it occur in transit? So was it with the means of transport that we understand was an approved means of transport from the quarantine facility to the airport? And then what was his activities through both airports? Because for all intents and purposes, both of those airports are considered approved zones at the AHPPC level for people to transit through.
Chief, is that what you meant when you said that how he caught it could impact national policy?
If he caught it in hotel quarantine, then New South Wales needs to know so they can address whatever it was that led to him catching it. If it was the method of transportation from the quarantine into the airport, then we need to work out what happened there so we can fix that. If it was in the airport or in that transit, then that's something we're going to have to discuss. There's obviously a lot of people movements through our airports, and we need to understand what occurred in that situation. There may be something we can identify that just needs to be fixed at the airport, or it might impact on territory and national policy. The problem is we just don't know how he caught it, and he got here. So how did he catch it? How do we fix it? That may be a quite practical solution at the New South Wales or ACT end, or it might be a policy decision we have to make here in the Territory. I'm obviously reluctant to make decisions without knowing it, and at this stage I'm confident we'll be able to work it out. If we get to a point in time where we simply don't know how we caught it, then we might have to go to unfortunately a blunt approach. I'd like to work out how we caught COVID so we can have a specific solution.
We've had with the government's hotspot policy, the way it works is some areas are locked down, but you can still travel into a major airport, say if you're in regional Victoria or regional New South Wales, and then fly to the Territory. Is it possible that if he's caught this in an airport, that policy would change and you wouldn't be able to transit through an airport if you came from a hotspot area?
There's a lot of hypotheticals, so I want to be careful getting into that. There's a lot of ways we may change our policy depending on how we caught this, but I can confirm what our current policy is, and I can have Dr. Heggie talk to it as well, because it's been around for quite a significant period of time now, and other jurisdictions essentially have the same policy. Your method of travel through a hotspot, basically don't get out of the car, and so on. So there's things like COVID taxis. There are ability to travel where the vehicle itself conducts itself in a certain way, which should provide means of safe transport. That's what we need to understand what happened. Again, this might be something better for Dr. Heggie to talk to because it happened a while ago now. The New South Wales incident with the driver of the limousine. So it's just understanding how did he catch this, and then what do we need to do to fix it. So I want to be a bit careful because at the moment there's just too many questions, and once we get the answer we'll get a good solution. But yes, it could impact national and territory policy if we know how we caught it.
Have we figured out whether he's vaccinated or not? That was an active question yesterday.
It's not a question he's answering. I want to be really clear. Dr. Heggie, as a medical professional, respects the right of this person not to divulge that information. I don't respect that. I would like to know his vaccination status because it would help me as chair of SEMPSI in making some decisions about how transmissible was this person. So we know vaccinations reduce the risk of transmission. I would like to have that information. There's an active conversation in the country at the moment about what can we compel people to tell us or not tell us, and when can we compel the telling of that information. I think this is an active example, in my opinion, about information I would like to have to be able to make decisions. But obviously, Dr. Heggie is a medical professional. I hope I'm not verbally you. Great respect between Dr. Heggie and I, has obviously respects the right of that person not to divulge that information.
Slightly different topic. Can I just ask about Katherine? So we've had some pop-up testing clinics and also vaccination clinics. What sort of numbers of uptake are we seeing down there?
In terms of testing?
Yeah, both.
Okay. So as I understand it, from memory, around 500 tests in Katherine over the 2 days. In terms of vaccinations, there's 1,000 accelerated doses have gone into Katherine, and you can book it. Not all those bookings are taken up. So I can't tell you off the cuff how many additional bookings have been made yet, but I do know there are still bookings available, whereas in Darwin it's in 5,000 additional bookings made. So I can get you some, I'll make a note, I'll get you the vaccination uptake or increase in uptake in Katherine, but we provide those additional vaccines for Katherine.
If we come out of lockdown at midday tomorrow, what's it going to look like as far as what people can and can't do? Can you give us some more information about that?
We're obviously going to do some more work today and tomorrow about what the restrictions will be post-lockdown. We'll obviously work around that serology result when I just got it, about what the 14 days are. So the serology is important for understanding what day one is, and obviously we work to a 14-day replication cycle. So I can't tell you the exact day today that the restrictions will lift, but obviously a 14-day replication cycle, and we'll talk about what that serology result means for what day one is. The restriction will be very similar to the last lockdown. We're just going to have a conversation today, because this is a slightly different outbreak with one case that we're working on, whether there can be some slight changes to that, and an active conversation about can a mass event occur, and how would a mass event occur would be an example of that conversation I want to have, knowing Darwin Festival's happening. So what would be doable? Right now, what I can tell you with confidence would be very similar to what happened last time.
Is it feasible that we will be able to reopen for very long, given how much spread there is in New South Wales and the chance that there's just going to be more outbreaks that spread across the border again? Can life go back to normal, basically?
I'm extremely worried about that. I'd like to say there'll be no more lockdowns, and that our border policies are sufficient. Our border policies significantly reduce risk. We just simply can't, I can't guarantee there'll be no risk. We just simply reduce risk. We've obviously had 2 lockdowns now in quite close together after having not done any since last year's national lockdown. The amount of cases in New South Wales, the amount of movement in New South Wales does worry me. I think it worries a lot of us. So I don't think I'm alone in saying that. I do think there is a chance that we'll have a few more lockdowns, unfortunately, between now and end of year. That's one reason why we are in a race for our vaccines, and we have to get as many vaccines as we can get and get them as many arms as possible, because we'll get to a point in time where we know from that national plan that we'll start reducing the need for lockdowns to be the response.
Just going back to this gentleman who's not sharing his vaccination status, considering he came from overseas to work in the NT, will there now be questions about whether we should mandate people to be vaccinated before coming into our vulnerable community from a place like the US?
So for entry into the territory, that's an active question. And as a country, we're actively having this conversation now about what we can legally do. So I think it's public, SPC are looking at can they mandate their workforce, etc. And so there's some open legal questions here. We've obviously mandated that everyone who works end to end in our quarantine facility is vaccinated. And so I am comfortable in situations like that, legally, that you can do that. The question is whether you can mandate it for access to the territory or not. That's something that, as a nation, we're working through what we can legally do. We've had early advice from the Commonwealth Solicitor General into the National Cabinet. So this is an active question. So I can't answer it for you today, but I'd like to say this. I believe I've demonstrated from the beginning of this pandemic 18 months ago that we'll do whatever it takes to keep the territory safe. We're the first jurisdiction to put up land-based borders in this country to make sure we controlled who could come into the territory and the circumstances in which they came, to make sure Territorians stayed safe. We'll do whatever it takes. So I'm doing the work now to work out what that can be, but if it's necessary to do and it will keep you safe, we will do it. That's what my promise to you is.
So put simply, your preference is that you won't be able to come to the Northern Territory unless you're fully vaccinated.
We're working through right now what are the advantages of vaccination. And so, as you've seen with our hotspot policy and how we quarantine, where you isolate, how long you isolate, there are a number of different things that you can work on. What are the advantages of being vaccinated and how does that translate through our hotspots policy? So I think you can see there's quite a number of questions I can't answer today, but there are quite a number of variables about what vaccination may provide you an advantage for. And so that's what we've got to work through. But importantly, I can't do any of that unless I know your vaccination status. And that's the crucial thing. Can I mandate someone's vaccination status at point of entry to the territory?
And is this something you're just looking at as the territory, or is this something that you're looking at with Victoria and Tasmania as part of this bigger group that's looking at the national?
Yeah. So the national task force that I'm on for the Northern Territory, representing the territories, with Victoria as the large state and Tasmania as the small state, working with the Australian government, is around that national plan and how do we implement those various steps of it. So there are a number of things that we're working on. One of them is what advantages come with being vaccinated, and that's an obvious one: travel within the country, attending major events, other things like that. What are the advantages of vaccination and how does that actually translate? We also cannot guarantee, or we shouldn't presume, that might be a way of putting it, we shouldn't presume that we're going to hit 70 and we're going to hit 80%. So what are the things that we do to make sure we genuinely hit those targets, 70%, 80%? And the obvious thing that people go to there is it incentives, but it could be policies, it could be method of, but basically let's not presume we're going to hit those targets. What work do we need to do to make sure we hit 70 and 80%? So how do you hit the targets? What are the advantages for hitting those targets? And when you hit those targets, what are the things that you do know? One of the things that we do know when we hit all of those targets is that there's going to be a large percentage of the community unvaccinated simply because they're not eligible for the vaccine. So for me, you can't have a plan for step B and step C of the national plan without also having a plan for our kids. It just can't be done. We have to know how we'll manage those places where our children gather. So childcares, preschools, primary schools are really obvious examples of, when we come to those steps, how do you look after our kids? These are people who can't be vaccinated. And we've got to, we must make sure that as a nation, we have a plan for our kids. when we hit 70 and 80%. And in my opinion, the national plan can't occur unless that plan exists. I'll be a voice for kids at National Cabinet. I'll be a voice for kids in our national plan. We simply have to get that right.
In December last year, you apparently told estimates that your Facebook page isn't the place to go for COVID updates. It should be coronavirus.nt.gov.au. Yet this morning you posted an update to your Facebook page basically saying there's 0 cases. Do you think that's appropriate for you to be posting on your own personal Facebook page that, you know, the NT has 0 cases?
Yeah, I think that's pretty straightforward. The press conference today was delayed. We're obviously having the conference today at a later time than normal. I thought it was very important to let Territorians know there was no cause for alarm in the fact that the press conference was delayed. I always recommend to people to get the best, most reliable information. That is coronavirus.nt.gov.au or Secure NT. That's absolutely where you should go for information. But obviously I'm the Chief Minister. It's the Chief Minister's Facebook page. We're 18 months into the pandemic. It is 2021. Facebook exists, so does Insta and Twitter. I'm aware of TikTok, but not on TikTok. There are different methods of talking to people, different channels that we use. You know, sometimes I don't wait 2 hours and get 40 public servants to tick off on what I say. Sometimes I do talk directly to Territorians through my Facebook page, but that is not where I recommend people go. coronavirus.nt.gov.au, Secure NT are the places I recommend. But today, I do think in the middle of a lockdown, delayed press conference, I thought it was important for me. I am the Chief Minister, I'm elected by Territorians, I talk directly to them to explain no cause for alarm for the delayed press conference, no cases. We're just obviously doing some work to get all the information together, and that's what we did today.
Chief Minister, just 2% of casual contacts have been tracked down. If there are still outstanding people tomorrow, how much will that play into your decision to lift lockdown? And could we maybe expect different instructions for Katherine if those contacts are there as opposed to going?
At this stage, not stressed about the 2%. All the test results coming back so far are negative, and obviously we're more worried about close contacts than casual contacts. So at this stage, not alarmed by that. I'd have to probably have a testing result come through positive in the casual contacts pool for that to be a concern. I might pass Dr. Heggie though to comment on that 2%. Just make sure that we're on the same page. But my understanding is we're okay with that at this stage if those other tests keep coming back negative.
Thanks, Chief. So as you're coming to understand, health practice is complex. And it's not linear, it's not an algorithm or an equation. It's something of that and something of this and where it is and how many. So just to clarify, vaccines do not prevent you from getting the virus. What they do is they stop you getting serious harm and death. We have had a local case returning from overseas where double vaccinated became infectious. So the next thing, as a health practitioner for 45 years, conversations between health practitioners and their patients, in this case, or clients, there's a need to actually keep some things confidential. Sometimes we've got to ask about certain behaviours, who they've been with and where they've been. There are others who have more authority to do that. But if I said that about the numbers are looking good, but it comes back to what is the purpose of the lockdown. And yes, the interest in when he acquired the infection has some relevance to other jurisdictions more than us. And that can be investigated as we do. If I could say that at the moment, the numbers in terms of very close contacts and casual contacts, all of those numbers are looking good. But don't forget, during the period of isolation, or call it quarantine, then there's other tests that are done to determine maybe you didn't have evidence of the infection at that point in time, and then there's a subsequent test and then a final test. So this is where we've got to go carefully, but again, the numbers are looking good when you gather all of that together. But again, I'd ask people to be patient about this. A lot of anxiety about big events, events people have bought tickets to, but we really have to go so carefully because we know the Delta variant, and I'll cite 2 examples. This is not about malicious behaviour or criminal behaviour. You may recall that the driver that transported Qantas aircrew walked past another person where they hesitated for both about 20 seconds and were wearing masks, we believe. Another was a person who was sitting in the corner of a restaurant and he was coughing. He may have taken his mask off because he was coughing, infected the waitress entering that private function room. So this is how infectious it can be. So we do have to try and manage to eliminate what we have here. And the spread through the territory would be as bad as going from Sydney, whatever direction it goes in, it was going to happen, and it did happen, and at the moment we still haven't got to that point.
Thanks everyone.